Welcome to Advancing Health. Coming up in today's episode, a conversation with Boston Medical Center about the launch of its Health Equity Accelerator program and the difference it's making to expand access to behavioral health services to historically underserved communities. Our host is Rebecca Chicky, Senior Director of Behavioral Health Services with AHA.
It is my honor today to be joined by three speakers from Boston Medical Center Health System. BMC Health System is a Foster McGraw Award winner. Their Equity Accelerator program has improved access to behavioral health services for historically marginalized and underserved communities. And so today, the three speakers that I am so lucky to be here with are Dr. Thea James, Trina Martin Cherry, and Dr. Christine Crawford. So first, I'm going to kick it over to Dr. James, VP of Mission and Associate CMO, and the Co-Executive Director of Health Equity Accelerator Program. So Dr. James, can you lay a little bit of foundation for this?
Sure, and thank you for the privilege to be here today. Back in 2020, there were many people across multiple sectors who were coming out with, I would say, commitment to equity statements. And at our institution, our leaders, our CEO and our COO at the time, decided that we were not going to do that. And mainly because, we serve a population that is predominantly, I would say about 70% identify as Black or Latino. And also, 3/4 of our patients are government insured. And so that just sets a picture only to state that there are many sort of structural barriers and systems that they face that often make it impossible for them to prioritize health. They're making rational decisions because they're prioritizing survival, I would say. But, we continue with prioritizing clinical excellence and innovation and that type thing. And so we have created many innovative programs that have been disseminated across the country. And so when people were coming out with commitment to equity statements in 2020, our leaders just didn't want to be a part of that. Instead, they made a decision to look inside our own house so that we could better understand some of the structural reasons that were preventing our patients from thriving. And we looked at the outcomes data for Boston. And what the leaders said is that we have been doing this work for decades and it has had no impact on the outcomes data. It's highly predictable who's going to do worse. So we looked inside our house across the entire enterprise, looking at operations, looking at clinical, inpatient, outpatient, research, education, human resources, even things like public safety. And of course, we found things. What they did was to bring together about 80 leaders and also to divide us up into 8 work groups that cover those areas I spoke about, including the types of things that impact beyond health, but things like economic mobility, which is a clearly root cause for why people are not able to prioritize their health. And so each work group was led by an executive, and there was a great deal of accountability put into it. There were dashboards we had to report out every month, and I had a 2-hour roundtable. It was quite intense. And we identified the clinical areas where there were highest rates of disparities and also some other areas. And we were charged with closing gaps over the next 12 to 24 months. And we had to identify which gaps we were going to work on. One of the things we wanted to do was to sort of challenge conventional wisdom in the ways in which people actually go about this work.
Dr. James, thank you. You just described why you named this program the Health Equity Accelerator. You didn't want to just identify where the disparities were, but to accelerate the implementation of closing the gap, of addressing and reducing those health disparities. So thank you for bringing that message home. I also heard you say, I think, that often when people get into this work, they have a need or a tendency to boil the ocean. There are so many disparities that we can address. but yet you went through a process of identifying some key specific health disparities and populations that needed those gaps closed, and do so with an operational approach compared to a research approach. Now, I'm sure there's a lot of research that went on because I've seen some of the data that's come out of the work that you have, but you rolled up your sleeves and were pragmatic. Was there anything I just said that was incorrect? Keep me honest here, Thea.
No, it's correct. That's something I think important that I left out is two very different approaches that have made this become such a proof of concept. It's what has enabled us to, we think, has enabled us to have dramatic gap closures and in record time, I would say, is that number one, when we look at data, we interpret it back to the root cause. And that was the work we did in decision to incision when the OBGYN department created a model or an algorithm for addressing unplanned urgent C-sections. So one is interrogating data back to the root cause, not being afraid to discover what you discover. And the second half of that is using the subjects of the data to interpret it, to tell you what it means, and partner with them to create solutions. So usually when we look at data, we sit down together and we come up with what these data mean. Even when people are writing papers about disparities or whatever, they sort of write conclusions based upon what they think the data mean, but not everyone has the lived experience of the subjects of the data. The data subjects, we work with them to add context to what the quantitative data means, and also, again, partnering with us to create solutions.
Thank you, Dr. James. And that's a really nice segue to our next speaker here today, Patrina, or Trina, as she prefers to be called, Martin Cherry, who's the Vice President of Community Engagement and External Affairs at BMCHS. I'm going to turn to you, Trina, to say, can you speak a little bit to where behavioral health and this work fits into the overall mission for BMHS? But also, as Dr. James was just saying, the subjects of the data, that lived experience is so important in really understanding how to make a bigger impact. And unless I'm mistaken, all of the subjects in there lived in your communities. And so the value and the importance of looking at the social determinants of health having an impact on the community health as a whole. I turn to you, Trina, to share some of that journey with us.
Hi, Rebecca. Thanks again for having us. And thank you for your question. And I think to answer, the base of it is that we don't see the community as subjects. Like, they are community with a lived experience that we could not do the work without having them and what their daily experience is at the table to really help us understand that. At BMC, we have an amazing history of having an incredible amount of trust with the communities we serve, because historically they've seen us as being an institution that is there for them in a multiple amount of ways. We often come out of our campus into communities and we show up for them in a way that's real to them. We have authentic partnerships with community-based organizations. So we think it's really important to make sure that when we are like planning a program through our Health Equity Accelerator, maternal child health, behavioral health, whatever it is, making sure that we are working with community health centers, community-based organizations, that we are using our community advisory boards to ask the questions about what we are doing. Are we doing it right? Where we need to flex? And when we hear back from them, we pivot. We understand that you can't invite the community to the table and ask them for advice and guidance, and when they give it to you, you don't move on it. And so that's one of the things that I really, really love about BMC. We take the advice of those with lived experience and pivot when necessary. In terms of the work of Health Equity Accelerator and the work we're doing in behavioral health, I think that it is important that we have those relationships with anchor institutions in the city of Boston and in the Commonwealth. So anchor institutions like community health centers, I mentioned those already, but also the Boys and Girls Clubs, the YMCAs, Boston Public Schools. we'd been there, we partnered with them in other things so that when we, wanted and needed to set up critical services, to make critical services in behavioral health available, there was trust there where it made them more willing to say yes and to partner with us. One other really great example about us reaching out to community, getting their feedback, and then actually stepping in and doing something about some of the issues that we heard in Roxbury, which is an incredible city in Boston, where the life expectancy is, I think, about 23-year life expectancy gap from the south end of Boston to Roxbury, which is literally about 2 bus stops. And there's a 23-year life expectancy gap. We spend a lot of time working in that community, talking to them, asking them what it is that they need, how we can, close the gaps on some of these things. And one of the things that we heard back was that they wanted more access to healthy food. They wanted more availability for Black businesses to thrive in that area. And so Boston Medical Center invested well over $1 million in a Black-owned grocery store. And so this is one of the things that really helped us to win the Foster McGaw Award, our work with Nubian Markets. The investment in that neighborhood with that particular business has been just incredible. So not only is it a beautiful grocery store with amazing fresh fruits and vegetables, it's also a halal butchery. It's also an incredible cafe where folks can get foods that are delicious but also healthy, prepared by a chef who has been featured in Bon Appetit. It goes to show that no matter what zip code you're in, you deserve the best food. You that deserve the best health care. You deserve the best opportunities to thrive.
Trina, that was fantastic. We got into healthcare to help other people, right? And if we're not listening to those people and what their needs truly are, we're missing opportunities to help. But Dr. Crawford, I'm going to kick it over to you now to share some of the experiences and inspire others to go on this journey.
Yeah, what we know to be true is that the patients who receive their care at Boston Medical Center, whether it's primary care, OBGYN care, whatever type of care it is, at the heart of their ability to take care of their physical health, we also have to address their mental health because we have fantastic providers, nurses, nurse practitioners, physicians here who are working tirelessly to improve the physical well being of our patients. But what we know as a hospital, what we know as a system, is that we really have to pay special attention to the mental health needs of this patient population while being mindful of the unique mental health needs of this specific population, just given their vulnerabilities and historically what it is that they've been through, and the fact that access to mental health supports, not only in the city of Boston, but also across the country, is quite limited. And so I've always appreciated how invested this hospital system has been in finding ways to improve access to mental health services for this highly vulnerable population. Not only are we invested in mental health supports within the physical walls of the hospital, and thinking about our psychiatric hospital that we opened a couple of years ago that's providing inpatient level of care for our sickest individuals who are living with psychiatric symptoms, but we're also looking at ways in which we can increase access while out in the community. And so having the opportunity to work in some of our community health centers, such as Codman Square, where they see a large number of primary care patients, and the overwhelming percentage of those patients are also living with mental health conditions. And so a number of our psychiatrists, not only do they see patients here at Boston Medical Center, but they're also providing care out in the community within these community health centers, which is fantastic because there are so many barriers that make it challenging for people in the community to come over to our hospital, even though we're not that far away. But it's a very complicated city to navigate, just given the way in which the city was designed because of historical practices way back when, that made it such that public transportation poses significant barriers for people to come into the city, into our hospital to get care. The other wonderful thing is that there have been a number of schools, not only in the city of Boston, but across the country, that have reaped the benefits of having mental health clinicians and specific mental health supports within the schools, since we know that kids are spending a large part of their lives inside of schools. It's a really important place to provide psychiatric care, to provide mental health care, so that we can meet the kids where they're at. So, here at Boston Medical Center, we have partnered with the Boston Public Health Commission, which has a number of mental health clinicians who work in health centers that are embedded in a number of middle schools and high schools all throughout the city of Boston. What's truly unique about these social workers and these licensed mental health clinicians is that they are hired to be in the schools to only provide therapy. Other social workers who are hired by the Boston Public Schools are hired to do therapy, to provide counseling, but they're also doing cafeteria duty. They're also doing school bus duty. They're doing the field trips. They're doing a whole bunch of other things and filling in all these different gaps that we see in a lot of the schools because it's been so hard to retain people in the school buildings. But these clinicians, all they do each and every day is provide therapy, 1 hour therapy to students inside of the school. What parents need to do at the beginning of the school year, they sign a permission form that grants the kid access to all of the services within the health center. Some of those services include mental health services. So, what's absolutely beautiful about this program is that if a student happens to develop some mental health needs, they can go straight down to the health center, pair up with one of the clinicians, and not have to talk to their parents about it, get special permission. It's fantastic. The other thing, too, is that these clinicians document all of their notes, all of their encounters in our medical record system at Boston Medical Center. So we have the capacity to communicate, these clinicians to communicate with their primary care providers at Boston Medical Center, as well as other providers. So everyone is looped in to all of the needs of this one individual child who spends the majority of their time in school. And being a psychiatrist, I meet with these clinicians monthly to supervise them, to discuss challenging cases, and to identify if there are any potential students who would benefit from medication management. And it's an easy referral to my clinic. And so the fact that we are investing the resources to connect these licensed mental health clinicians, these social workers who are providing therapy in school, such that they are documenting in our medical system, closing the loop, making it such that we're filling this need is absolutely wonderful. And not a lot of health systems are thinking outside of the box in that sort of way, and BMC is.
Wow, that is phenomenal. The ability to have those notes integrated into the EHR so that it goes to their primary care physician, the fact that the licensed mental health clinicians working in the school are able to focus on that one purpose. And the fact that that distraction doesn't happen in this case is just so phenomenal. Thank you so much for sharing your time and expertise here today, for being innovators. You've inspired us and inspired the listeners. I'm going to challenge all of the listeners to help get your dream in terms of accessing mental health services. Regardless, there should be no wrong door. And thank you so much for the work that you do. Keep up the great work. You brought joy in my heart, and I hope others today as well.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.